ever faced into an incident where you had to combat an assailant in hand-to-hand combat. You have no room between you, it's just body to body, and all your other options are pretty much extinct by this point. It is in a case such as this that a knowledge of pressure points will become extremely useful. Incorporating pressure points into your fighting style is an incredibly efficient technique in the fact that it attacks and overrides an assailant's central nervous system. I learned this information after a class I took last semester that was offered by Dave Davis, who was also the head of security here at the college. And we are going to talk about the pressure points that are located in the head and neck, central core, and extremities of the human body. First off, with the pressure points that are located in the head and neck, there's the mandibular angle, which is located right at the bottom of your ear, right between your jaw and neck. The practical use for this pressure point is that you can use it to break a chokehold. So if an assailant is, so in the case that an assailant is trying to choke you out, you would take your middle fingers, press right behind that joint, and press your fingers into that assailant's eyes, and you can rotate them and break that lock, which will allow you basically to get free, because you only have 15 seconds of air once it starts choking. The other pressure point that's located on the face is right on the tip of your chin. This is extremely efficient in that you can get at it very easily. So you can basically engage it by either a palm strike to the chin or just strike with your fist. And that could end up basically knocking the assailant out because nerves that run down from the top of your brain connect right on the tip of your chin. Then there are the pressure points that are located in your neck. These are extremely cool because they're stun pressure points basically. So your suprascapular motor point is located on each side of your neck. So the way you would engage this is you would take the inside of your arm, step forward, and smack the side of the assailant's neck. And by doing that, you usually will drop the assailant, is the goal, at least for a certain amount of seconds. Another very efficient way that you can employ it is blocking a strike. So if he throws a strike, I catch it and strike the side of his neck. So basically by that point, I've just defeated the attempt he made, and now he has basically been taken out of the fight temporarily. Then the other one that's located in the neck is the suprascapular motor point, which is located right at the base of your neck, right on your shoulder. The best way to use this is in what we call a hostage rescue situation. So say he's trying to choke another victim or hurt somebody else, and I'm behind him. I can take my fist, drop it down on that pressure point, and drive towards the center of his back. And that will temporarily stun him, take him out of the fight, and give me and his other victim a chance to basically escape. The pressure points that are located in the chest, there are two of them. The brachial plexus clavicle notch, and then there's one that's located in the arm known as the median motor nerve point. The brachial plexus clavicle notch is located right above your collarbone and right below your shoulder. So the best way to use this is if you need to keep an individual in a stationary location. So if you sit down and check these. So I can press down on this with my thumb, and he won't be able to easily get out of this chair. And basically, I don't have to manhandle him or anything. I can just keep him there. And the way you could use this is if you're going in the medical field and you need to keep a patient in a bed, in a chair, so they don't hurt themselves, and you can't be like physically manhandling them. The pressure point that's located in your arm, the median motor nerve point, is located right in the middle of your forearm. The best way to use this is an escape technique. So if he tries to grapple with me, for example, I can break that by striking the inside of his arms, even before he gets a chance to actually get into the position. Also, if I need to block a strike, by impacting that, that'll also cause a lot of pain and a weakness point in his arm. The other group of pressure points are located in the legs, and this one that is located on the outside of your leg is known as the common peroneal. It's also my personal favorite because it's the easiest to get at. So it's located about halfway down your leg in about a 4-inch area. So you can engage this by delivering an angle kick to that point, which will basically just make your assailant want to lie down. It will temporarily incapacitate them, and they will not trust me, want to keep fighting you after you've done that. The other way that you can engage it is if you need to deliver a knee strike to the side of that. So say you get on their side and you can do that. That's another way the cops can get people to sit down if they need to. The other pressure point is located on the inside of your leg, and it's known as the femoral motor point, which is basically the exact, has very similar characteristics to the common peroneal. The way you can engage it is also with an angle kick or in a takedown situation. So if he tries to throw a strike, I'll block it, strike the brachial plexus origin, which we just talked about, and then I would deliver knee strikes to that location, which would basically eventually just shove him down towards the ground. It allows me to get away from the situation. So in conclusion, we've gone over the pressure points that are located in the head, neck, central core, and extremities of the human body. Incorporating pressure points in your fighting style is incredibly effective with the fact that it overrides and defeats an assailant's central nervous system. So if the moment demands for action, respond with the knowledge, what you've just learned, and incorporate it into a fighting style and make it strong.